Hi, folks. It is Dr. Holly Lucille with Healthy Happenings, brought to you by Natural Partners. We're going to talk about healthy hearts, or maybe not so healthy hearts, because for a long time, heart disease has claimed the number one spot globally for being really the number one killer of both men and women. And I've got board certified natural holistic Dr. Jack Wolfson. All right. Sorry, are we live? We're live. Sorry. So I wasn't looking at your name. I've got Dr. Jack Wolfson with us. Hey, thanks for being on the show. I'm so sorry about botching your interview, or excuse me, your introduction. But thank you for being here.
Listen, obviously, as you know, Dr. Holly, in this kind of business, you got to have thick skin. So it takes a lot more to upset me than just botching my name, I assure you. Great to be on. Thank you.
Blame it on, thank you so much. I'm going to blame it on Blake there for saying Wilson, and I just had it in my head. But Dr. Wolfson, really, I appreciate you being here. And I do want to talk about it. It's cardiovascular disease, number one killer. But from the stats that I read, it's continuing to be on the rise. Can you talk about that?
Well, I think that the world is becoming a more and more sicker place. Modern medicine isn't doing anything about prevention. They're just trying to cover up symptoms. And therefore, the more and more people that are out there, the longer people are living, the diseases of the third world are kind of, going away as we improve sanitation and we improve access to food and water and safety and shelter to these people. Then what is left is the long-term chronic diseases. And of course, you see the explosion of cardiovascular on top of it. But fundamentally, it's just a sicker society with poor nutritional choices, poor lifestyle choices, and heart disease is the manifestation of that.
Yeah, it amazes me too, because there's shows like this, there's posts, there's tweets, there's white papers, there's webinars, there's summits. There is more information out there now than ever to help people stay and get well, and certainly to combat cardiovascular disease. But as you said, we still have these chronic health issues on the rise, and I think there are so many confounding, influencing factors because of that, or contributing to that. But it also blows me away. We've got more information, and it continues to be on the rise. So I think also one of the points that I want to ask you about when it comes to cardiovascular disease, I don't think there's another disease entity that has not just conflicting information when it comes to the right diet, but sometimes diametrically opposed recommendations, anywhere from low fat to low carbohydrate or vegan to paleo. What is up with that? What's the scoop?
Well, I certainly think that when you talk about nutrition, it's as emotionally charged as any, right or left side of politics or religion. It is right up there with any of those. And I know because I've been in those battles. I've been in those battles and arguments with people who think differently than I do. I've been in the arguments with people that are vegan and people that are vegetarian, people that don't believe that important, or people that are not concerned about GMOs. Well, listen, to me, it's very simple, Dr. Holly, is that our ancestors ate a certain way for millions of years. It was all organic and it was paleo foods. So every society in the history of the world has been a meat and or seafood eater. Why try and restrict those food groups? Every society in the history of the world has eaten organically. The vegan diet is experimentation as far as I'm concerned. I think that it's okay for a cleanse. I think it's okay for a detox, but I do not think it's a long-term strategy. Every animal on the planet eats either other animals or they eat insects. The only pure vegan is found in a small population of human beings, and I don't feel that's appropriate. Why try and reinvent what we've learned over millions of years? And that's paleo.
Okay, so being a board certified a holistic natural cardiologist, what is your recommendation then when you've got patients coming in specifically for cardiovascular disease when it comes to diet?
Well, certainly it's a matter of, no matter what diet you follow, and I talk about this in my book, is that no matter what diet you follow, can we please agree that it should be organic, keeping the pesticides out of the food, keeping the chemicals out of the food, destroying the planet. Let's make everything organic. So let's agree on that facet first. And then after that, you can follow the quote-unquote paleo pyramid. And I've got a copy of that in my book that I made up. And the foundation is plants. It's eating tons of green leafy vegetables, and eating nuts and seeds and eating avocados and coconuts and olives. I love all that stuff, but I do believe everybody has to for sure eat seafood. That's very clear, right? As you know, it's so important to get those healthy omega-3 fats into your diet, and you can't get them from walnuts and flax seeds. You have to get it from eating seafood. I think the literature is very clear on that, and the school of common sense. The healthiest people on the planet eat fish. And then if you want fed meats on top of that, I'm great with it. The Eskimos eat a ton of it. Their health is fine. It's been documented over the years that people that do eat paleo foods do the best. So that's what I advise. I do not think in any way, shape, or form we need to eat grain, certainly not gluten-containing grains. I think dairy is for baby cows. Humans have their mother's breast milk, cows have their cow milk, giraffes and whales have their milk. If you're going to be drinking milk, I think you should do it in the raw. And that's where I'm at with nutrition.
Great. So tell me the title of your book.
The book is called The Paleo Cardiologist, The Natural Way to Heart Health. And 17 chapters, over 260 pages, over 300 references. I do recommend in there, and I feel very strongly about this, Dr. Lucille, that coming from a medical standpoint, I know, and I've seen what I've seen. My suggestion is for people to make a holistic doctor their primary care doctor. So your primary doctor should be a naturopathic physician, a doctor of chiropractic, a homeopathic physician, someone who really addresses the whole picture, someone who thinks about natural first and pharmaceuticals last.
Right. So using the least invasive methods to diagnose and treat first. And so in your book, I love that you mentioned the paleo pyramid, because when it comes to paleo, and I think it's sort of a buzz connotated word right now in our culture, a lot of people, I think, get confused where it's, oh, you're only eating meat, you're only eating meat. But in that pyramid, as people will well see, those plants are extremely important. So I'm so happy that you mentioned that. Now, you also mentioned lifestyle. And I know of the people that come into my office who are either being diagnosed from me with cardiovascular disease, mixed hyperlipidemia, or come into my office already carrying that diagnosis. A lot of times, I would say 93% of the time, completely modifiable with diet and lifestyle. From a lifestyle perspective, what do you think, or how much do you think stress and what kind of stress contributes to cardiovascular disease?
Well, I think stress is extremely important. And I know your educational training was definitely different from mine, because mine was so heavily influenced by pharmaceutical companies, is that stress is a major factor. I wrote an entire chapter on this in my book called One Nation Under Prozac, right? We're not deficient in Prozac, but we're deficient in many different things that lead to poor mental health. And it's all over the medical literature how anxiety, stress, anger, depression, those all markedly accelerate the risk of broken heart syndrome, cardiomyopathy, where you have these middle-aged women that undergo a very stressful event. Maybe it's a job change or a sudden divorce or something that is very stressful, and the woman has a massive heart attack. Yet when we go in there with catheters, we do not see any evidence of blockage. There's no evidence of significant coronary disease. So what likely happens is a stress-induced spasm of those arteries leading to a massive heart attack. And it's scary and it's unfortunate. So if we can reverse that and say, hey, listen, let's try and prevent the stressful episode, that's certainly all fine and dandy, but it's not that easy. But I think also is that this is an opportunity to prevent this beforehand with these women. So if you take these women and you make them super healthy before a stressful event, they're not going to have that broken heart syndrome. So how do we make them healthy? We put them, we make sure that they're on the right foods. We make sure that they're getting the sleep. We might make sure they're getting the sunshine, and we make sure they take supplements, for example. So I love all those different nitric oxide boosters, because whenever I test a woman who has been diagnosed with that broken heart syndrome, they never have nitric oxide. So I think if we got that nitric oxide on board, it will prevent a lot of problems.
All right, we're going to talk more about that. So you mentioned tests. What do you think are the best tests that people need to understand the results of, to understand where they are from a cardiovascular perspective, both with treatment and prevention?
Well, one of my favorite tests is certainly regarding leaky gut. When my wife and I first met, or the woman who would become my wife, when we first met, she mentioned the topic leaky gut. I kind of like laughed in her face. I'm like, where'd you come up with this bogus diagnosis, leaky gut? I said, I went through 4 years of medical school, 3 years of internal medicine, 3 years of cardiology, a few years on the job. No one's ever mentioned leaky gut. It's your problem. Go ask people about it. So I went to go ask some natural doctors. And, you know, for example, like my good buddy, Dr. Decker Weiss, naturopathic cardiologist down here in Arizona, and other homeopathic physicians and chiropractors, they all talked about it, but once again, it's not in the medical literature. Well, now the medical literature has exploded on the concept of leaky gut, and now we can actually test for it. So you see the leaky gut, you see that people are getting chemicals into the body that don't belong, then the immune system activates, inflammation, oxidative stress, and when all that stuff is happening, it all damages the cardiovascular system, what we call leaky heart. And now that you have leaky heart, or it can manifest in the brain as leaky brain. When you have all these leaky tissues, that's where disease develops. That's where inflammation, oxidative stress come in. Now, the cardiologists understand that it is an inflammation problem, but they're not looking at the cause of the inflammation. They don't care. Their answer is statin drugs, and it's unfortunate. A lot of other advanced testing that people could do, but I would certainly encourage people to test for leaky gut, right? And then they can work with natural doctors like you and I, get on a leaky gut protocol and repair that, and will live happily ever after.
All right, so interesting. I wasn't expecting that to come out of a cardiologist's mouth, but I'm so great, because you're right. In identifying and treating the cause of anything, if inflammation is indicated, and in cardiovascular disease, it is heavily indicated, we want to understand the source of that. So hyperpermeability, otherwise known as leaky gut, is extremely important. And when you fix it, people feel a whole heck of a lot better. That is for sure. So another question, what do you consider heart-healthy nutrients?
Well, I think first of all, I think everybody belongs on a multivitamin. So it's very simple. The multivitamin is the foundation to any healthy lifestyle and supplements regimen for sure. It covers just all the bases. So I'm a big fan of the multivitamin. After that, I think everybody should be on probiotics. I think everybody should be on omega-3 fish oil in addition to eating fish. I think everybody should be on some kind of a daily greens drink. And I'm sure, obviously, as you know, most people have digestive issues, so a digestive enzyme is also warranted. I kind of call that my foundation 5. And after that, I think, you know, by using the power of the most advanced testing in the world, we can really kind of hone in on what additional supplements or lifestyle changes the person needs to make. But you know, once again, the medical doctors aren't even interested in any of this kind of testing. They think everybody who walks in through their door is a candidate for statin drugs and aspirin. And doctors like you and I are here to say, wait a second, that is obviously not the problem. We were not born deficient in statin drugs. We were not born deficient in aspirin. What is the cause? What is the reason why people are having these events? And by doing so, holistic doctors like you and I are just light years ahead of the conventional medical docs, which is sad. It's sad for the world, and it's certainly sad for my previous, you know, my brothers and sisters in those in the occupation. I left a group of 40 cardiologists to start a holistic cardiology practice, so they just don't get it.
Well, I'm happy that you do, and I think that the consumer should be happy that you do too, because what we're talking about, Dr. Wolfson, once again, is that we've got the #1 global killer of men and women continuing to be on the rise. So what we've been doing in the past is not working, and thinking, I think, outside the box, or, you know, I kind of think of things like this as going back to the future in a sense, because traditionally, really traditionally, we used to do all of this. I mean, everything was organic, and we were looking at things much more holistically and understanding multiple contributing factors like stress, like lifestyle. Certainly, diet can be causative or curative. And to the future, this is where we're going. If people really want to heal and get better, we look and serve to get in there and understand, identify, and treat the cause. So thank you so much for all that you're doing. Mention your book one more time and where people can get it.
I kind of lost you.
Okay. I was just wrapping up there. Mention your book one more time and where people can get it.
Yes, the Paleo Cardiologist, the natural way to heart health. You can get it on Amazon, but I would appreciate you coming to my site. It's cheaper on my site, thedoctorswolfson.com. Doctors is abbreviated DRS, and I really appreciate the support of the community. I lost a lot of friends on the medical side, but coming to the holistic side, meeting doctors like you, Dr. Holly, I know I have friends out there in the world, and it's a great thing.
Hey, there's friendship and brothership and sistership in thinking things through. And I think people get better because of that. And so we're looking for the source, especially when it comes to cardiovascular disease. We want to knock that down as the #1 killer and all the other chronic diseases. And I think with a mind like yours and the way that you approach patients, we can certainly do that. So heart healthy nutrients, think about those foundational 5. Decreasing stress, making sure you're identifying and treating the cause. Think about tests other than C-reactive protein. Wonder if you have hyperpermeability. Those are the messages from Dr. Jack Wolfson, and thank you so much for being here with us on Happy Healthy Happenings. Boy, I'm going to botch the incoming and the outgoing here. All right. Until next time, folks, we will see you later. This is Dr. Holly Lucille with Natural Partners, signing off with Dr. Jack Wolfson.